Welcome to the Medovia Menopause Podcast, Business Edition, your trusted source for insights on menopause and midlife in the workplace. Each episode features meaningful conversations with inspiring guests. Tune in and enjoy the show.
Welcome, everybody. We are in Menopause Month. This is the Super Bowl of those in the menopause business. So thanks for joining us today. We are excited to have Dr. Joanne Armstrong and Carmilla Tan, both from CVS Health. Dr. Armstrong is the Vice President and Chief Medical Officer of Women's Health and Genomics. That's a hard word to say. She is a physician, a health policy expert, and a national leader in women's health and genomics. And at CVS, she directs the strategy, program development, and innovation to improve outcomes and reduce disparities for women across the U.S. Carmilla Tan leads the benefit strategy for CVS Health, overseeing programs that support well-being of more than 300,000 colleagues. She previously headed global benefits at Bank of America and held actuarial and leadership roles at Brighton Health Plan Solutions, IBM, Mercer, NYL Care, and Guardian Life. We are excited to have you both. Thanks for joining us today.
Great to be here.
Thanks for having us.
Yeah, sure. So Dr. Armstrong, as a women's health clinical leader, what motivated you to champion menopause support at CVS?
Great. So, as you said in the introduction, I'm head of women's health, and we really spent a lot of time thinking about the needs of women across their lifespan. So when you take a step back and say, who are women in this ecosystem and how do you think about it? A few things are really important, and they relate to how women experience the menopause journey. So women are the dominant healthcare consumer and decision maker in their homes and in our country. They make about 80% of all healthcare purchasing and wellness decisions. That's a lot. It translates to 80% of a $5 trillion health spending activity in the country. Women have a lot of challenges actually in making sort of good decisions for themselves and in many cases for their families. So what are some of those challenges? Women have enormous pressure on their time. About 2/3 of all unpaid caregivers in the country are women. About 15% or so of all households in the country are led by single women. And that puts a lot of pressure on them. About 1/3 of women say that they miss care because of time and cost. Another challenge in women's health is many of the areas, the conditions that women experience over their whole life course are under-researched at sort of a national science level. It means that there's a lot about women's health that we just don't know, observed outcomes that we just don't know a lot about, and menopause actually sits a little bit in that space. And then importantly, a lot of women's health is just pure clinical care is stigmatized. For historic reasons, maybe cultural reasons. It's surrounded by embarrassment so that women don't talk about it, and in many cases don't know how to get education around the conditions that they experience. And when they do, perhaps there's some shyness or embarrassment about it, and all of that leads to poor outcomes. So menopause actually sits sort of at the nexus of all of those challenges, right? And so what does it mean? So now we're going to drop down into menopause. So just in terms of the experience, all women, if they live to the age of about 51, will go through this life course. About 80-ish% of women are embarrassed to talk about it. And that embarrassment is like in their families, in their workplace, with their physicians. And so a lot of needed care just doesn't take place. And we know that about 1/3 of women are misdiagnosed when they present with menopause symptoms, thinking that it's some other condition. Some of the reasons why that happens is the workforce is woefully undertrained in this space. About 20, maybe 30% of physicians say that they have been formally trained in menopause. So when women do recognize the symptoms, the complex that they have, bring themselves to a position where they can talk about it, they enter a clinical practice, and most of the physicians that they will encounter are not formally trained to help support it. So that is a large cohort of women. Carmilla will talk about this sort of false idea that things happen in healthcare in one silo, but they don't come into a workplace. That's just not true. So that's what, that's sort of the high level issue. In terms of what women experience, lots of disruptive symptoms, hot flashes, mood changes, sleep disturbances. If you don't sleep well, it's very hard to perform at the top of your game, the next morning. And then a bunch of cognitive changes, short-term memory challenges, etc. If only this were short-lived, and a lot of people think menopause is a single point of time in time. It's not. The average set of symptom complexes last about 7 years, but the long tail of it can be as much as 14 years for women. And it happens both pre-menopause and after. And technically, I should say what menopause is that point in time after which menstrual periods stop for 12 months. So it's kind of a look-back diagnosis, but the whole process, which really represents hormonal changes in the function of the ovary over years before that, the technical definition of menopause hits, and then years after. So we talk about the external symptoms, these disruptive symptoms, but there's a lot of other medical changes that are happening under the surface, not fully appreciated by women, but really critical in terms of setting the stage for our health for the next 30, 40 years. Some of those changes include changes in cholesterol and lipid profiles, which influence heart health. We have a pretty quick elevation or escalation of cardiovascular disease in women after menopause. Estrogen is important in maintenance of bone structure. So as estrogen levels wane, you start seeing osteopenia and osteoporosis. That's bone loss. Mental health challenges, rates of depression, anxiety increase. So all of these are really important things that are happening under the surface, but without a conversation about what it means and how do you think about holistic health. And for these women, it's a challenge. And it is common. 9 to 10 women will have some type of menopause experience. And when, as I said, it doesn't respect the front door of your home, and then when you walk into work, there's absenteeism, productivity issues, et cetera. So, creating a strategy, bridging these gaps, thinking really strategically, pragmatically about what can you do to help women in all the places that we live, work, and play, right? Have solutions, understand what this is about, and then build solutions. And a lot of that involves the workplace.
Yeah, absolutely. And I love that holistic approach. Having worked alongside CVS Health, we know that you took a holistic approach when you introduced menopause support within your organization. And I think I'll pass this one over to you, Carmilla, from a benefits perspective. Dr. Armstrong unpacked a lot of reasons why menopause support, midlife support, women's health is important to look at in the workplace and the why. But from a benefits perspective, why focus specifically on menopause? From CVS Health's perspective, why was investing in menopause support a business priority for you specifically?
Again, April and Kim, thanks for having me. This is a great discussion, and I always love presenting with Dr. Armstrong. So as head of benefits at CVS Health, maybe we'll start a little bit about who we are, and then share a little bit about our journey. But, we are the nation's leading health solutions company with more than 300,000 colleagues. You may know our brands. We have Aetna, Caremark, the MinuteClinic. Hopefully, you're customers of our CVS Pharmacy, and we have clinics like Oak Street Health and Signify Health. We have a view of unified capabilities, to help members and patients. So we have healthcare benefits. We have a pharmacy benefits manager. We have retail pharmacies and many clinicians. By the numbers, we have about 9,000 CVS pharmacy retail locations. We have 1,000 walk-in medical clinics. We have hundreds of primary care clinics. We have the leading pharmacy benefits manager, and our Aetna business takes care of more than 36 million people. And when you think about our diverse colleagues, right, with diverse needs, 300,000 colleagues, the types of work that our colleagues go to every day, sometimes they are in stores, they're in pharmacies, they're in warehouses or transportation, clinician corporate offices, and, some people are on call centers and also focused on technology. When it comes to benefits at CVS Health, we pride ourselves in offering great benefits for great people. We offer a variety of programs and resources designed to meet the needs of our colleagues and their families. We're focused on physical, emotional, and financial wellness because all three are really interconnected. The aging workforce continues to play a vital role for our company, right? Midlife women are now leaders and key valuable contributors. There are nearly, I think, 75 million women in the workforce. 20% are going through menopause. And, menopausal women specifically will soon make up the biggest demographic of the U.S. Workforce. And then to make it personal to CVS Health, 70% of our workforce is made up of women. So we have a real focus on women's health. To stay competitive, we need the best minds, especially in clinical care, pharmacy, data science, all sorts of careers. And having women at the table, and Dr. Joanne Armstrong is one of my MD advisors. Whenever I have a question, she's so great to talk to, and I get her thoughts. So we design solutions that meets the needs of our colleagues. And, job seekers care about women's health support, and there's a clear demand for menopause care and resources.
Yeah. No, that's great. And I think many people don't realize how broad a business you have at CVS Health. Like, everything from warehouse to frontline workers to office workers. And so it's a really great example of what you can do to support women in diverse workplaces. Dr. Armstrong, you've been working on women's health support well before you joined the Medovia membership. And when we first met you, there was only a few things that you hadn't done for women in this space. Where did the journey begin for you?
So it was a long journey. I think you can hear from Carmilla, like how important women are, right? Internally, it's a huge constituent group, right? And she talked about this demographic movement that's happening, right? It's going to be a key part of the workforce. So some of it begins with just understanding, like, who are you as a company? Who are you as a culture? Who are you serving? Some of the ways that we get insights from that are just like different ways of listening to women, right? What are their barriers? What are they facing in navigating their health? And I shared some of those early on. And then as we started sort of coming down the funnel to say, what does this mean in midlife care, menopause and midlife care? We really started thinking very intentionally about what those barriers are, right? And it probably took us about a year and a half of all this intentional work before we got the accreditation. But as you noted, it was work really systematically thinking about what is the problem, what's the barrier, how do we approach that. So the barriers we talked about before, some of those are just for the clinicians. What does training look like? How do we bring training into our own environment? We have about 900 MinuteClinics, nurse practitioners that are providing primary care, including longitudinal care. How do we get them trained up to understand what menopause is and perhaps what it is not so that they can help in this space? What do the network of other physicians look like, for our customers, including Aetna? Can we get menopause-trained providers in there? We cannot wait a generation or even 2 generations so that all the residents are trained in menopause and then become available to women in the workforce in the United States. So those are some of the barriers. And other big ones are education, stigma. How do we talk about it? Like, how do we build a floor underneath our colleagues here and, customers, women work, and other organizations so that they are both appropriately educated about this, feel empowered so they can talk about it, perhaps get coaching and some other services so that they can move sort of into a health journey. So we've done all of that. As I said, to do that, like, you can hear that it really takes an enterprise-wide commitment to this. Carmilla is my thought partner, my key and important.
Listeners can't see, but she just made a little heart.
Carmilla just made a little heart.
Inside work sister here, because she has the voice of our colleagues, 300,000 people, 70% of whom are women, right? Very pragmatic. What are pragmatic things that we can do to help to translate these ideas into actually concrete solutions for folks? So we work with our benefit leads for sure. We work with our network strategists so that we can bring providers that are able to deliver the care right now. We work with data scientists to say, how do we connect people to the services that we have just built? We work with our front store. What are the products and services that are there that help women? And how do we make it easy and convenient? And there are many other ways that we did that. So what I want to say here is that it is an enterprise approach. It takes many different sort of folks that Carmilla talked about in the early part of the call, like who are we as CVS Health? And then joining Medovia really helped us refine it, right? Identify the gaps, and we had a few gaps, and helped us sort of put kind of some capabilities in place that we could sort of adapt rather than build ourselves. So that's sort of how we did it over about a year and a half.
Yeah. What you're really talking about is that cultural shift. It's a holistic approach, but it's a long-term sustainable solution. And we love that. Medovia really puts a stake in the ground with that. Menopause friendly means something to us, and it equates to cultural change. And it does take really everyone committing to it within the organization to make that happen. I'll throw the next question out to either one of you, Dr. Armstrong or Carmilla. You mentioned, Dr. Armstrong, that there were a few gaps that needed to be filled. And we've heard from several individuals from your organization that when you joined the membership, you used our menopause-friendly checklist, which, by the way, listeners, you can download that for free from our website. But you used that to identify those gaps, and then we came in alongside you to fill those gaps. Can you share what some of those action steps were?
I can start, and then Carmilla, maybe I'll hand it to you. Some of the gaps that we had were kind of formalized educational content. We already had what we call our colleague resource groups, where we sort of talk and use that venue where we're actually talking to our own colleagues, providing education, et cetera. But more sort of online content we didn't have. I think we sort of recognized that in order to feel comfortable talking about menopause at work, you need to also train other folks in the ecosystem, managers perhaps, talk to senior leaders, be comfortable about, talking about this topic at work. But we needed the training. The checklist showed us that we really didn't have, manager content, for example, and that really helped us at Medovia, helped us fill that gap. Carmilla, do you want to share some of the work that you've done to sort of make all the information available to our colleagues?
Yeah, and before that, I will say when Dr. Joanne Armstrong pulled this together, I remember we did this breathing exercise, Dr. Joanne, where we go inhale, exhale, say the word menopause, and everyone goes menopause. And
all together now.
All together. And it's funny because, some people think you actually need to be in menopause to even think the word,
right,
much less say it out loud. And so, just the working together has been great because, we had men on the group, we had, people in different demographics, and just having, and even like when we won the award and, going back to the stigma, we had leaders talking about, the accreditation and, this is not sacred. These are not sacred words. And so it was really great. But, just going back to, your original question, here at CVS Health, we have our colleague resources group. It's voluntary, colleague-led, and represents, a wide range of professional culture, other affinities and interests. And many large employers have CRGs. And so we worked with them. We have more than 29,000 colleagues who participate in one of our 17,000 CRGs, 17 CRGs. And so one of the CRGs that Dr. Joanne and I participate in is the WISE CRG, Women Inspiring Success and Excellence. And this is a team of passionate leaders uniting our voices to elevate and inspire women across the world. I love that mission. And so going back to that focus on holistic care for female colleagues navigating midlife changes, that checklist was really important because as we thought about, opportunities and where, we could, strengthen what we already offer, right? Education, peer support and coaching, training, benefits, right? To make sure that specialized benefit programs and these resources and trainings could, it's not enough to have the message and the program. You actually need to communicate it throughout the organization. And I feel really strongly, Dr. Joanne, that just our efforts, including the work of our CRGs, really amplified some of the communications related to what we offer in terms of menopause support.
Oh, that's great.
I'd like to offer there what's interesting when we hosted our first CRG discussion on Let's Talk Menopause. We had, I think, 800 to 1,000 people sign up within about 24, maybe 36 hours.
Yeah.
So that really illustrates that there is this need for information, education, community, right? And a place to talk about this, and importantly, to get resources, right? To get pointed in the right direction. So that was a bit of an aha moment. It was about a year ago or so. We have had subsequent conversations like that with our colleagues, and we've got a number of them planned also for this month. But I use it just as a proof point that colleagues want this, they need this, and it represents sort of this opportunity actually for everybody, all employers, to kind of think about how you're serving the health needs and the wellness needs of employees.
Yeah. On that note, Carmilla, why did you decide that the accreditation mattered for your employees? And thinking about that, have other companies in the broader business community, have you made an impact? Have you heard from others like, you guys are doing amazing work, let's talk about
And
it?
what are you doing? Right.
Yeah.
Absolutely. For us, pursuing the menopause-friendly accreditation really validated the work that we've been doing to help ensure our colleagues have access to the resources they need to live as healthy as possible. So, and as a result, we were so proud that we were the first U.S. company to receive this accreditation. It was really great seeing this external validation of our commitment to women's health. And our goal is not to be the only employer to receive this recognition. We're talking to our peers on the why and the how. Every meeting I go to where there are benefits leaders, I always say, I'll show you the way. Just ping me. I'll show you like the game plan, what you need to do. But it really is, it enables the whole organization to say, hey, this is not a sacred word. We can talk about it. And given that all employers have women, it really is so doable. And so, again, a lot of companies, you have all the basic sort of building blocks to get this accreditation. It's just a matter of putting it together and, taking you up, Medovia, on your checklist to see the path on how to get this accreditation.
Yeah, thank you.
I love that. The roadmap, right? The roadmap is what people are looking for. But to your point, Carmilla, most organizations have a lot of the essentials that we would call it in place. They just don't know it. So it's bringing it all together and putting the pieces of the puzzle together. I think, at this point in the podcast, we've probably sparked curiosity. I'm sure we have. I'm sure that a lot of organizations and individuals that are listening are curious now. And I'm wondering if we can dive just a little bit deeper. Either Dr. Armstrong or Carmilla, or maybe both. Can you share some of the specific initiatives that CVS put into place? You mentioned the holistic approach. You mentioned communications and training and education and manager training, but I'm thinking about some of the special small pieces that perhaps we haven't mentioned. I believe you have coverage for supplements within your CVS locations, or at least they have, a credit to spend towards supplements if they choose that supplemental care. Perhaps you're covering hormone therapy. Can you talk a little bit about some of those specific initiatives that have really made a difference?
I can start, Camille, if that's good, and we can just go back and forth. So there are a number of things, right? So we talked about education and how we use our colleague resource groups to sort of to create a place where we can be educated, et cetera. and then turning that into actual real training material that's in our learning center. We've created peer support and coaching programs for our colleagues. These peer support sessions are guided by professional clinicians so that colleagues can, interact, ask questions, learn about it. We've talked about our Let's Talk Menopause team channel. This is popping all day long with people, and it's really a group support issue, learning from each other. In the healthcare delivery side, we brought the Menopause Society in to train our MinuteClinic nurse practitioners. We've also worked with our network folks to bring in provider groups that are Menopause Society trained, right? I talked about that, including using data science to say, these are patients that may actually benefit from this, and proactively letting folks know that these services are available. And we did that actually for tens of thousands of people. We've looked at our formulary to make sure that it is comprehensive, and it is. And then we have some plans that have what are called over-the-counter benefits that they can use, basically supplemental dollars for menopause and other related health services, and that's in place as well. Carmilla, do you want to talk about sort of how your team worked to sort of put it together in a way that people sort of can understand their benefits comprehensively?
And so for our colleagues, our own CVS colleagues, we provide access to clinicians trained in menopause care, and we have offerings tailored to support midlife health. So we also have it's great to have these, assets that we can influence. So we have in-person and virtual services at MinuteClinic with in-network virtual providers specializing in menopause. The specialty actually matters. We also have for our colleagues who are in our company sponsored medical plans, we cover medically acceptable means of diagnosis and treatment of menopause. For all our colleagues, we actually put it all together, and I'm sorry you can't see me because this is not a video podcast, but we have our menopause and midlife care support guide, which has all the important information to navigate life events, which menopause is, for all our colleagues. And as with any of our life guides, we also translate this into Spanish. And so, sometimes people need to, it's not enough to have the policy. You need to make sure that you can bundle it in a way that people can absorb it and say, oh, yep, that's me. And, how do I go navigate? And then, as we said, physical, emotional, financial, the emotional part is also important, right? The no cost confidential counseling available through our EAP program. We offer up to 20 visits, confidential counseling, per year. So making sure that you have like a holistic support for your colleagues.
That's great. And when we've talked to some of the companies, they're like, we have too many employees. I don't know how we would implement something like, what you're talking about, but you have over 300,000 people as we said earlier, in many different environments, office, retail stores, pharmacy, clinical. You talked about all that. How do you look across all of those environments and kind of make sure that you're serving all of those folks in an appropriate way, in a way that meets them where they are?
Yeah, I think just understanding that, there really is different backgrounds, health needs, and situations for whether you have 1,000, 100 colleagues, 1,000, or 300,000. And personalizing care to meet the unique features and conditions of people's needs is really important and necessary to make sure they have access to good quality health care. We're focusing on menopause and personalized care for this demographic. There are other life stages and conditions that can be personalized too, but we're starting with menopause. And so being able to train managers, empower them with resources. We talked about that breathing exercise, which, ladies, I think we need to do at the end.
I was going to say we should have started the podcast like that.
Yes. Yeah, that's not a sacred word. But, just having some, people who can understand that, hey, this is real, and being able to shy away from the stigma or being able to just say the word, and also being actively listening for, hey, I think we have benefits specific to that. We have a lot of flexible resources that are available to women, where and when works best for them, whether it's resources for living or virtual and in-person MinuteClinic services. It really helps with the physical and emotional wellness.
Carmilla, I love that example of the breathing exercise that you mentioned. And I know we've talked a lot about cultural change and cultural shifts. Do you have any other gold nuggets like that? Examples that you can give us of how you've really seen the culture shift within your organization? Because that stigma is something that we hear often. We know that menopause, menstruation, women's health in general sometimes can carry that stigma. And it's hard to get people in organizations talking about a topic that they're not usual or are not used to talking about. Are there any other gold nuggets that you have that are examples of how you've seen that culture shift?
Yeah, I'll say, Dr. Joanne and I have done several conversations together, and it really is a sign that there's an audience out there. Again, we're 70% women. Why wouldn't we talk about women's health? And so it's a sign that, our employees and also other employers are eager to hear more about menopause support. We've seen great engagement internally. And, even later on, I think Dr. Joanne is hosting a menopause documentary viewing party. So that is going to be very cool with our colleagues. I'll just say personally, I love working here at CVS Health because we can, influence, business. We can take care of our colleagues. We have a mission, and we're really focused on making sure we have the best minds thinking about these problems and finding solutions for them. So thank you, Dr. Joanne, for working for us being able to work together.
Yeah.
It's been
A
wonderful.
party sounds like fun.
Yeah,
A
I know.
screening party, first of all. Yeah.
That sounds, yeah, I would love that.
That's fantastic. Kim and I often say we work with so many organizations, who we would work for. At the end of the day, if we weren't doing what we're doing with Medovia, and what you're doing at CVS Health is remarkable. And we both have said, yep, that's an organization we would work for. So we can applaud you on that front.
Yep. So, Dr. Armstrong, what's next? What's the next steps in this health space, in this space for CVS?
Well, so, the recognition that employers are really important, right? We spend employed women, we talked about how large part of the workforce this is. We spend 40 plus hours a week, right? In an environment, we want to bring our whole selves to it. So it's a health issue. It's a human talent, a human capital issue. And as we said, there is no front door that closes that says, no, I'm in the workplace and, all the symptomatology goes away. So when you think about it that way, our goal is to bring this to employers, to help them understand it is a workplace health, wellness, productivity, and it's a business issue as well. And so what we are trying to do is to kind of make us not be the exceptional company, although I think we are an exceptional company. And I think, behind Carmilla and me, we've got committed people, wonderfully talented teams that are very passionate about personalized health for all people. In this case, it's menopause and women's health. So what we are trying to do, what's next for us, is to bring this to employers, to recognize that it is so important in women's lives that we bring alternative, creative, innovative ways to bring health to women, recognizing that women have less time, more demands on their time. So bringing digital health solutions, retail health solutions, telephonic health solutions. And if you, listen to how Carmilla and I talked about this, we really leaned into it. How do we bring telephonic providers of menopause-trained, care to folks? How do we use data science techniques to bring people to the services they need? So a key focus for us going forward is like scaling this for other customers, keeping our own colleagues engaged, learning, bringing them new things. And, as Carmilla said, we're going to have a screening this afternoon of a film for our colleagues, right, to sort of bring the voice of other experts in the space to them. So that's what we have planned for coming up. And I would say the other thing is recognizing, for us and programming around the fact that menopause has a lot of disruptive symptoms. That's kind of a little bit of what shows up at work. But the, two kind of clicks down are medical conditions that don't necessarily show up at work, but are really important to sort of to optimize. So cardiovascular disease, bone health, mental health, those sort of come along the journey of aging and midlife care, and we'll be doing some programming in that space.
That's fantastic. It's the postmenopausal stage that you're mentioning now with the bone health, the cardiovascular health, and of course there are things we can do as preventative measures to ensure that we don't end up with things like osteoporosis, right? So I love that that focus is really for lifespan. Not just this one moment in time that we often think about when we think of menopause. And I'll come back to that original comment that you made at the beginning of the podcast, Dr. Armstrong, that menopause isn't just a moment in time. It's important that we follow this through, if you will. I'm wondering, Carmilla, if an organization is listening to this podcast, what's one piece of advice that you would give them if they want to follow your lead?
I think it would be, start with assessing whether you have a women's health strategy, and if so, what it means in your organization, right? I think about, early on, I didn't even, think about, hey, you just assume all the doctors are trained on everything. But the reality is you need specialized training if you have a specialized issue. And so, after you assess, your strategy, offering tailored benefits is a good way, and making sure it's, comprehensive and holistic in supporting the population, which in this case is women. It's so important to make a business case for women's health and making sure that wherever you are, whatever company or plan you represent, that there is, some vision to make sure you can carry out support for your colleagues, your employees, their families. And once you have all the pieces, and I'll tell you, if you are in a company that, whether it's a small company, a large company, I suspect you already have the business blocks to get the accreditation. So I would say go and find the checklist. And I'm sure, April and Kim, hopefully you'll link out to the checklist, and because most companies and plan sponsors have the building blocks. It's just a matter of putting it all together.
Yeah, that's great. We have wanted to have this conversation with you since we started partnering about a year and a half ago. So it's really amazing to be able to come together today to talk about this because you've done so much work. Dr. Armstrong, what kind of message would you want to leave our listeners with during this World Menopause Month? Why does this work matter? What would you recommend for people that are trying to move forward with this strategy in their own workplace?
So it matters because there are a lot of people affected by this, and it is a natural part of aging and the journey that we're all on. If we're fortunate enough to live to about 50 or so. Symptoms can be uncomfortable. They can be hard to talk about, but it is a natural part of aging, right? And that is why we need to talk about it. We need to be educated, take proactive steps. I think also important for women is recognizing that while we kind of all experience this, the journey is very unique. The set of symptom complexes are very different. How we approach it may be different. So what is really key is having access to resources and using them. Resources that are, trained and knowledgeable and can be helpful. I'd recommend to listeners that they look at the Menopause Society. You can search the portal on their website and find providers that are trained. They'll say, I'm part of my own community chat, and this question comes up all the time. How do I find a provider trained in menopause? So that's one of the answers. If you're a patient and you feel like what you're reporting is not being, to your clinician is not being affirmed, get another opinion. We do this in all areas of life, but it's really important. Again, it sets the stage for wellness through the rest of our lives. Thinking about managing holistic health, it's not just about sleep disturbances. Like when that's gone, you're good. That's not the case. actually starts before 50, and staying on a wellness journey is really important, right? So managing your sleep, managing your weight, thinking about your diet, thinking about socially, how do we build communities? And then one of the communities that's really important is for this stage of life. So find your group. We have a wonderful one here at CVS Health. The chat goes off like all day long, but it just means that people want to talk about it. They need to talk about it. So there are other groups that, like Let's Talk Menopause, has some really terrific content. So create that. Be free to talk about it. Be a champion for people around you to talk about it, and that really helps everybody else.
That's
so good.
fantastic.
Thank you.
I love that you mentioned community too. I think we often forget that. We talk about building your tribe, building your community, and having that support. It's really key to happiness. It's key to being able to share our journey and for individuals to feel like they're not alone. So thank you for mentioning community. As we wrap up here, we end all of our podcasts by asking the question, what best piece of advice rather, have you ever received? And it doesn't have to be menopause related. It certainly can be, but really anything just from a personal perspective. So we can share those little gold nuggets with our listeners, either Dr. Armstrong or Carmilla, whoever wants to go first. I'd love to hear from both of you.
I'm happy to go first. So I'm an actuary by way of background, and the advice that most actuaries get is risk is opportunity. And so sometimes you take a calculated risk, but risk is opportunity. So whether it's this or some other initiative or opportunity, take a swing.
Love it.
That's a good one.
Dr. Armstrong, do you have something you'd like to share?
Yeah, I mean, I'm an optimist by nature, and I think what I try to infuse in my kids and people around me is, lead with positive intention, enter new interactions with positive intention, keep that curiosity there to ask why. Why does this person think this way? Why is the system set up that way? And I think if you lead like that, you enter new situations like that, you will both surprise yourself and you'll find out actually where your interests and other people's intersect.
Guys, those are good. Those are good ones. Thank you for sharing them. Where can people find you and information about CVS if they want more information?
Well, I think it's at cvs.com is one place to start. But, whether it's the internet, we're both on LinkedIn. And again, if any employers are out there thinking, how do I get started? Feel free to find me on LinkedIn and ask me. I'm happy to share.
Yeah,
I think that's, that spirit of community. We're hearing that thread throughout this podcast. And, we need to applaud you. Let's take a moment to, kind of give the little hand shout out here and applaud you because the listeners can't necessarily see us, but we're celebrating right now because truly it has been a wonderful journey working with everyone at CVS Health to bring you to that accreditation. But I applaud your efforts even before you started working with Medovia. As listeners, you've heard with the discussion today, you really laid the groundwork before we even came into the picture. And so thank you for your efforts in really championing women's health and supporting women's health. We can't wait to see what you do next. But mostly, I want to thank you for being a leader in this space. You did receive the first accreditation here in the US, so bravo. But what I love is your heart and your passion and your willingness to share with other employers. So thank you so much for your passion, your hard work, and for being willing to pioneer. Pioneering can be hard, but it can also be exhilarating. And I feel the celebration here as we sit on this call together. So thank you so much for all that you do. We appreciate the partnership.
Great. Thank you for that recognition. And thank you right back at you for Medovia, who sort of kept us on a straight and narrow, being very strategic, focused on these are gaps. Here's how we can help. So it's been a really wonderful collaboration, both in our company with Carmilla and team and many, many others. and with you as well. So thank you.
Yeah.
Yeah, absolutely. Let's go help more people. All right.
Yes. Are we
Let's
going to do our
advance
breathing
women's
exercise?
health. Pardon
Yeah.
me?
Should we do our breathing exercise?
Yeah, I was just going to say we
Okay,
can't end without doing our
Everyone-
breathing exercise. Carmilla, do you want to lead us with that? And listeners, do it
Sure.
with us. Okay, here we
Okay.
go.
Everyone inhale. Exhale, say the word menopause. Menopause.
Menopause. I love that. Okay, everybody's going to start their day with menopause. Let's break the stigma, everyone. And for listeners, if you're interested in membership or accreditation, we'd love for you to join other employers like CVS Health. You can reach us at medovia.com or menopausefriendlyus.com. Either one of those websites, you can download the checklist for free. We'd love to come alongside you. Kim, any words of wisdom before we end?
No, but maybe I'll get to use your ending. Hey, everyone, find joy in the journey. And until next time, have a great day. Thank you,
everyone.
Dr. Armstrong and Carmilla.
Thank you.
Thank you for listening to the Medovia Menopause Podcast. If you enjoyed today's show, please give it a thumbs up, subscribe for future episodes, leave a review, and share this episode with a friend. Medovia is out to change the narrative. Learn more at medovia.com. That's MIDOVIA.com.